Okay, so the next injury we're going to talk about is shoulder impingement. And this occurs when the acromion rubs or impinges on tendons in the shoulder, causing irritation. We're going to take a look at these in just a minute. It can cause irritation, pain, and loss of range of motion. It can be due to bone spurs forming and rubbing on the tendons. If it's due to bone spurs forming, if you don't know what a bone spur is, it's usually a growth on the bone due to some type of stress on the bone. And so in this case, it's going to affect the tendon. If it's due to bone spurs, it's going to be an older person. It's more common in people who use their arms overhead, such as swimmers and baseball players, the pitchers, because of the fact that they're bringing their arm over so many times. And also in tennis, because if you think about it, you throw the ball up to serve, and then you come over with the top of your arm to hit the ball. Okay, and it could also just be simply due to a minor injury. So let's go ahead and take a look at this. So right here, once again, we're looking at the shoulder joint. So let's start with over in here. This is my clavicle. If you remember, we've been talking about this a few times. This is the clavicle. This is called the coracoid, which we haven't really talked a whole lot about on the shoulder. But if you notice right up here, and this says acromion, I know it's small. This is the acromion right there. If you remember, we just got done talking about the AC joint, which would be right here. So this is the acromion right here. And see how there's tendons that are down underneath here? So what can happen is, and again, this is the acromion that's right here. Let me put a big A right there. That's the acromion right there. So you can see how there's tendons and stuff underneath it. So as you move the shoulder, especially if you're going to lift it up, it's going to go up into this area here and start to rub or push tendons against the acromion. Okay, so here's another look at it. This against the clavicle, there's the acromion. You can see you also have a bursa, which is just like a fluid-filled sac that's underneath here. But you can see how close the acromion comes to tendons and stuff. And then right there, you can see it's on a tendon or on a bursa that's right in there too. So it almost looks like it's biting down on it, and that's not what happens. But if you'll notice, the arm is going this way because this person is actually lifting their arm. And normally you have to go higher than this. You got to do a lot of overhead type of motions. Think about a swimmer and how a swimmer's always pulling or putting their hands above their head to get their hand in front of them while they swim. So let's take a look at another one. Okay, and although this is blurry, you can see here, this would be the acromion that's up in here. Okay, it's my acromion. You can see it's over here too, the acromion. And then you can see how it's pinching on there. That's the impingement. Okay, a lot of times too, the good thing is that this will actually go away on its own a lot of times with some rest after a while. Most of the time in sports injuries, rest and some ice will make most sports injuries go away. But you can see the impingement that's on there. Okay, so here's our symptoms of impingement. Pain in the front of the shoulder that may radiate to the side of the arm. Usually it's going to be just simply because the tendons go down onto the side of the arm. So that's why the pain may radiate to the side of the arm. Pain is present with both activity and rest. Okay, so normally, if you have pain with activity, it tells you there's some type of muscle involvement. But in this case, the reason you have the pain with the activity is because of the fact that you're impinging the shoulder even more. And then when you rest, that's usually when you're going to have pain because of the fact that you're irritating ligaments and tendons. Okay, and then obviously there's going to be pain when you bring the arm back. When you're doing a sport where the arm needs to be extended overhead, like we already saw, baseball, tennis, swimming, things such as that. The pain may occur when you're bringing the arm back to the normal position, because sometimes what will happen as you lift the shoulder up, the head of the humerus or the arm will actually just kind of do the gravity come down a little bit, and because muscles relax a little bit. But then when you're coming down, it comes back and it might catch a certain area that the impingement occurs. Okay, and just like there's pain when reaching behind the back because of the fact that the the humerus, the arm bone, comes up and hits the acromion. And of course, decreased range of motion, because if it hurts to put your hand above your head, you're not going to put your hand above your head. So the treatment for this is usually rest, ice, some heat, maybe take some aspirin, and that could basically help it go away. It may take a while to go away, and the reason being is because of the fact that it's tendons, and it might be the bursa, and those don't have a very good blood supply. And so therefore, what will happen is they take a long time to heal. Muscles have a good blood supply, so they heal relatively quick. Tendons and ligaments and bursa do not. So they're going to take a while to heal. And so that is it for the shoulder impingement.